Hello, I'm Derek, and I'm here to talk to you about VA examinations for the male reproductive organ. These exams are for prostate cancer and other prostate conditions, erectile dysfunction, or ED, epididymitis, as well as other conditions. This exam may be completed based on medical records from previous exams, or a new exam may be performed. Additionally, not all of these exams require the doctor to observe the condition. This is determined on a case-by-case basis. For example, veterans who are being examined for ED often present after receiving a prior diagnosis. These veterans are frequently interviewed by the examiner, and the examiner is looking at previous medical records to verify the condition. These conditions can be service-connected on a primary basis if they started in service or within a year of discharge. Additionally, these conditions can be service-connected on a secondary basis if they are related to other service-connected conditions or their treatment. For example, ED can be service-connected secondary to mental health conditions or medications for mental health conditions. Other means of service connection are related to exposure to toxic chemicals like Agent Orange and toxic water at Camp Lejeune. 38 CFR Section 4.115b is the regulation that defines how ratings of the male reproductive organ are evaluated. ED is rated under Diagnostic Code 7522. The rating there is 0%. However, you are still compensated because you will be given SMCK. SMC stands for Special Monthly Compensation. SMCK specifically is for loss of use of a creative organ. Alternatively, prostate cancer is rated under Diagnostic Code 7528. That rate continues for 6 months after treatment, surgical, X-ray, anti-neoplastic chemotherapy, or other therapeutic procedure ends. At which point, the rating is based on voiding dysfunction under 38 CFR Section 4.115a. Most frequently, this rating is based on how often you go to the bathroom during the day or night, or the frequency with which absorbent material is changed. Moving on to the DBQ walkthrough, the examiner fills out page 1 based on the request from the VA. There is nothing important to address on this page. On page 2, the examiner should mark all the diagnoses and their date of diagnosis. You can help the doctor by being prepared with all the information and related documentation. You would prefer the examiner to list all diagnoses and the appropriate date of diagnosis. You should be prepared to describe when the condition began and when you started getting treatment. You should also provide any medication used to address the condition. This section also addresses orchiectomy and renal dysfunction, as those are common courses of treatment or symptoms. These are less common from my experience helping veterans. Page 3 has the sections for voiding dysfunction. This is very important for any residuals that can be rated accordingly. It includes a box in 3C for how often absorbent material is changed and 3E for frequency of voiding. Make sure you are prepared to answer those questions based on the options here if you're going for one of these examinations. The information in box 3F can be used for rating purposes, but it is less common in my experience. On page 4, box 4A simply asks if the veteran has ED and to address etiology if known. That is a good time to describe when you started noting any such issues. If it relates to a service-connected condition or medication for a service-connected condition, you can speak to the start of ED corresponding to either. The bottom of page 4 addresses a physical exam. In my experience, it is rare for veterans to be examined and is only necessary to address specific loss. This is true of the examinations of the testes, epididymitis, and prostate as well. Page 6 addresses neoplasms, or what I would call tumors. While you should help the doctor as much as possible, it is likely they will be filling this page out based on other medical records if you have been treated for this condition. Page 7 addresses the functional impact, and it is always an important section to be addressed. What you want to say here is how this has caused you to change your lifestyle to accommodate this condition. In terms of ED, there is nothing likely here to help your overall rating, but in the case of a condition which has avoiding dysfunction, then you would want to make sure you address how it impacts your ability to work and your social life. These statements could help, especially if you are filing a claim for individual unemployability. That concludes the video on male reproductive conditions. Hopefully this will help you prepare for a more successful examination when you have your VA requested examination. For more information, click on the links below this video. Remember to like and subscribe for more content from VA Disability Group about your VA benefits.